They say the most dangerous things in life are the ones you never see coming. But what if the threat was already inside you, hiding in plain sight? You wake up one morning. The sun filters softly through the curtains. You stretch. Make your way to the kitchen. Brew your usual cup of tea. Everything feels the same. But inside your arteries, something is building. A slow, silent storm. No sirens. No warnings. Just layers upon layers of something sticky, clinging to the walls of your blood vessels. Until one day, a simple walk feels unusually tiring. A short breath becomes shorter. A strange ache lingers in your leg, then disappears, only to return the next day. You chalk it up to age, to stress, to weather. But it isn't. It's cholesterol. Not the kind you hear about in health class, but the kind that has been quietly weaving a trap over the years. Often ignored, often misread. And for millions of seniors across the world, this silent invader is doing damage long before the first real symptoms appear. Not with a bang, but with a whisper. A whisper that too many fail to hear, until it's too late. Because high cholesterol doesn't knock. It doesn't shout. It creeps. Slowly. Carefully. Silently. And that silence is what makes it so deadly. Today we're going to uncover 5 signs of high cholesterol that are often missed by seniors. Subtle, sneaky, and far too often dismissed. This is not just about numbers on a blood test. This is about the quiet signals your body sends, that most people never recognize. Before we uncover the hidden signs, let's take a moment to understand the enemy. Cholesterol. It's a word we've all heard. A word tossed around in doctors' offices, mentioned in passing during health checkups, printed in bold on the results of blood tests. But what is it, really? Cholesterol is a waxy, fat-like substance that your body actually needs. Yes, needs. It helps build cells. It assists in producing certain hormones. Your liver makes it naturally, and foods you eat, like eggs, cheese, and red meat, add more to the supply. But like all things in life, too much of a good thing can turn deadly. When there's excess cholesterol in the blood, particularly LDL cholesterol, often called bad cholesterol, it begins to stick to the walls of your arteries. Imagine pouring grease down a narrow pipe every day. It doesn't clog right away. It coats slowly, quietly, until one day, nothing flows through. The same happens inside your body. Plaques form. Arteries narrow. Blood struggles to pass through. The heart strains. And sometimes, the plaque cracks open, triggering clots that can lead to heart attacks or strokes. The terrifying part? You don't feel any of this happening. There's no burning pain, no loud alarm. Just a slow, quiet progression that accelerates as we age. You see, as we grow older, the elasticity of our blood vessels decreases. Our metabolism slows. Our body becomes less efficient at clearing excess fats. Even those who have never had cholesterol issues in their youth can suddenly find themselves facing dangerous numbers in their 60s or 70s. And while younger people may bounce back from warning signs, for seniors, each missed signal carries a greater risk. But here's the twist. Not all signs of high cholesterol appear in your chest or heart. Sometimes, they show up in your legs, in your eyes, in your memory, or even in the texture of your skin. These are the signs that whisper. The ones that blend into the background of everyday life. The ones that doctors warn us about, but too often, we ignore. And that's where we go next. Let's begin with the first sign. One that many seniors dismiss as nothing more than just getting older, but could be the body's desperate call for help. It usually starts with something small. A tightness in your calf. An odd heaviness when you walk uphill. Maybe you pause for a moment, catch your breath, stretch your legs, and then it fades. So you think nothing of it. But the next day, it returns. Not a sharp pain. Not something alarming. Just discomfort. You tell yourself it's arthritis. Or maybe the shoes. Or simply age catching up. But what if it's something else? What if that subtle ache is actually a warning from your arteries? One you can't afford to ignore. This is what doctors call peripheral artery disease, or PAD. And one of its most common early signs is intermittent claudication, pain or cramping in the legs when walking, that goes away with rest. You see, when cholesterol builds up in the arteries, it doesn't only affect the heart. It can block the blood vessels that carry oxygen-rich blood to your arms and, more often, your legs. As these vessels narrow, your muscles don't get the oxygen they need, especially when you move. And so, they protest. But because the pain disappears when you rest, many people dismiss it. Especially seniors. They blame aging, think it's nothing serious, and never bring it up to their doctor. Meanwhile, deep inside, the arteries continue to harden, continue to narrow, continue to starve the legs of life-giving blood. Over time, that leg pain might grow more frequent. Eventually, it could appear even at rest, perhaps as a coldness in the foot, or a numb sensation at night. And in the most severe cases, PAD can lead to open sores, infections, or even amputation. But it doesn't have to get that far. The key is recognizing the sign early, when it's still just a quiet whisper. When it's still reversible. When walking brings discomfort, not danger. So if you or someone you love begins to notice strange aches while moving, especially in the calves or thighs, don't brush it off. It could be the body's way of saying, "Help me. I'm not getting enough blood." And the cause? Might just be cholesterol. But that's not the only place cholesterol leaves its trace. Sometimes, it leaves a mark where we least expect it, on the face. Let's move to the next sign. Sometimes, the body doesn't whisper from the inside. Sometimes, it leaves a mark. Not a bruise. Not a scar. But a small, soft, yellowish patch. Usually near the eyes. It doesn't hurt. It doesn't itch. And because it grows so slowly, many seniors hardly notice it, until one day, someone points it out in a photo. Or in the mirror. Was that always there? They wonder. This quiet visitor is called xanthelasma, a cholesterol-rich deposit that often forms on or around the upper or lower eyelids. Flat. Slightly raised. Pale yellow. It looks harmless. In fact, it is harmless, physically. But beneath the surface, it may be saying something dangerous. Xanthelasma is one of the few visible signs of high cholesterol. When cholesterol levels are elevated in the blood, some of it begins to accumulate in the skin, especially in areas where the skin is thinner, like around the eyes. Doctors don't fully understand why it tends to appear in that particular spot. But what they do know is this. Xanthelasma is often a marker of elevated LDL cholesterol, low HDL, or familial hypercholesterolemia, a genetic disorder that causes dangerously high cholesterol levels, even in younger people. In older adults, the presence of xanthelasma is often overlooked or seen as a cosmetic issue. Maybe it's just old age spots, they say. They cover it with makeup. Ignore it. Live with it. But while it doesn't hurt the skin, it can be a red flag for the heart. Studies have shown that people with xanthelasma are more likely to develop heart disease, even if they have no other symptoms. It's a subtle sign. A quiet marker. But one that speaks volumes, if we know how to listen. So the next time you notice a soft yellow bump near the eyes, on yourself, a parent, or a friend, don't just see it as a skin issue. Ask the deeper question. What's going on inside? Because sometimes, what shows up on the face is just the surface of something much deeper beneath. And while these patches may appear painless, the next sign can feel like a pressure, a weight, especially when the heart is already crying out. It doesn't always feel like a dramatic heart attack. No clutching of the chest. No collapsing to the floor. Sometimes it's just a strange tightness. A faint pressure across the chest after a short walk. A heavy sensation when climbing the stairs. A mild burning after gardening, or reaching for something overhead. You stop. Rest for a moment. And it fades. So you continue your day, thinking nothing of it. But that moment, those few seconds of discomfort, may have been your heart struggling. Gling to push blood through arteries that are no longer wide and free, but narrowed, stiff, and lined with cholesterol. This is what's known as angina, specifically, silent or stable angina. Unlike the sharp, crushing pain we associate with heart attacks, angina caused by cholesterol buildup can be subtle, dull, predictable, easy to ignore. It happens when the heart muscle doesn't get enough oxygen-rich blood, particularly during physical effort. And the culprit, more often than not, is atherosclerosis, the gradual narrowing of arteries due to cholesterol deposits. For seniors, this type of angina is particularly dangerous. Why? Because aging bodies often adapt to discomfort. We expect to feel slower, weaker, more tired. So when the chest feels heavy after carrying groceries or sweeping the floor, it's brushed off as just aging. But here's the truth. Your heart should not feel pain after light activity. Not in your 40s. Not in your 70s. Not ever. Each of those subtle chest sensations is your heart waving a red flag, saying, I'm working harder than I should. I'm not getting enough blood. And behind that flag is usually a wall of cholesterol that's slowly closing the passageway. Left unchecked, this can lead to unstable angina, and ultimately, a heart attack. So if you or someone you love has noticed that simple tasks are now met with unusual tightness or discomfort in the chest, don't wait. Don't guess. Don't blame age. Because the difference between silent angina and a fatal event might only be a few months, or even days. And while chest pressure speaks with weight and urgency, the next sign is quieter, more elusive, more often misinterpreted as something else entirely. It starts with little things. Where did I put my keys? Why did I come into this room? What was I about to say? You laugh it off. Blame it on aging. Everyone forgets things sometimes, right? But then, it happens more often. You find yourself losing track of conversations, forgetting appointments, pausing longer than usual to recall a familiar name, noticing that reading a simple article takes more effort than it used to. And quietly, in the background, concern begins to grow. Could it be dementia? Is it Alzheimer's? Or is it something else entirely? Something that doesn't begin in the brain, but in the blood? What many don't realize is that high cholesterol can also impact cognitive function. Yes, cholesterol, the substance we often associate with heart attacks and strokes, can slowly rob the brain of its sharpness. Here's how. Your brain is hungry. Though it makes up only about 2% of your body weight, it uses 20% of your body's oxygen supply. And to function properly, it relies on a constant, unimpeded flow of blood. But when cholesterol builds up in the arteries, that flow slows. Tiny vessels in the brain become narrowed, stiff, or even blocked. The result? Less oxygen, less fuel, more struggle. Over time, this leads to what doctors call vascular cognitive impairment, a decline in thinking, memory, and focus due to reduced blood flow to the brain. And in seniors, this decline can happen subtly. It doesn't always come in big waves. It comes in soft fades. Reading becomes tiring. Finding the right words takes longer. Multitasking feels impossible. And because these symptoms are so often linked to normal aging, they're dismissed, forgotten, ignored. But when high cholesterol is involved, these mental changes are not just about getting older. They're about a brain that isn't getting what it needs to thrive. And the tragedy is that many of these changes are preventable. Reversible, even if caught early enough. Because memory loss doesn't always start in the mind. Sometimes, it begins in the arteries. And while these quiet shifts in cognition unfold slowly, the next sign shows up in the mirror, clearly visible, if you know what to look for. You look down at your feet. There's a small cut near your ankle, barely noticeable at first. But days pass, then weeks, and it still hasn't healed. Maybe the skin around it feels cooler than usual. Maybe your toes look slightly purple. Or your nails seem more brittle. You shrug it off. Just dry skin, you tell yourself. Or poor shoes. Or bad circulation from sitting too long. And in a way, you're not wrong. But the real question is why your circulation is poor in the first place. Once again, the answer may lie in cholesterol. When cholesterol builds up in the arteries, the effect isn't limited to the heart or brain. It reaches the smallest capillaries in the farthest parts of the body, often the feet and lower legs. As these tiny vessels narrow, blood struggles to reach the skin. And without oxygen-rich blood, the skin begins to suffer. Cuts take longer to close. Bruises stay longer. Skin can turn reddish or purplish in patches. In some cases, the legs or feet may feel numb or unusually cold to the touch, even in warm weather. These signs are silent cries from the body. Your skin is telling you that healing is not happening like it should. And that's not just a skin problem, it's a circulatory problem. And often the root of it is cholesterol. In seniors, these signs are tragically overlooked. Because with age, healing naturally slows. But there's a difference between slower healing and no healing. Between dry skin and tissue that's not getting enough life through the blood. If you notice a loved one, especially an older adult, who always seems to have open sores on their feet, or unusual skin color changes that don't go away, it's time to look deeper. Not at creams or ointments, but at arteries. At the flow of blood. At cholesterol. Because while a wound on the surface may seem small, it can be the visible sign of a much larger invisible problem growing beneath. And once that problem reaches a critical point, the cost may not just be pain. It could be amputation. It could be a stroke. It could be a life-changing event that might have been prevented with a simple blood test, and a closer look at the body's quiet warnings. So now you've heard them. The signs. The whispers. The quiet warnings that so many seniors overlook. A tightness in the leg. A yellow patch near the eye. A heaviness in the chest after a short walk. Moments of forgetfulness that didn't used to be there. A sore that simply refuses to heal. Individually, they seem small. Harmless, even. But together, they draw a pattern. One that points to something far more serious than just getting older. They point to a vascular system in distress. To a network of arteries that's slowly being narrowed, stiffened, and silenced by layers of cholesterol. And that's the tragedy of it all. Because high cholesterol is not dramatic. It doesn't cause sudden pain. It doesn't scream for attention. It waits. It hides. It whispers, until the damage is done. For many seniors, these whispers go unnoticed. And in the silence, they lose precious time. Time that could have been used to reverse the process. To clean the arteries. To strengthen the heart. To restore blood flow to the brain, the legs, the skin. Time to live, not just longer, but better. But there's another side to this story. One filled with hope. Because the body does speak. Even when the voice is soft. Even when the signs are faint. And if you listen closely. If you learn to understand the language of the body. You can act early. You can change the ending. Getting older doesn't have to mean getting sicker. It doesn't have to mean surrendering to fatigue, forgetfulness, or fear. It can mean wisdom. Awareness. Prevention. Because it's never too late to check what's happening inside. All it takes is a simple blood test. A conversation with your doctor. A few changes in what you eat. A few more steps each day. And above all, the courage to pay attention to the quiet signs, before they grow loud. Maybe today you feel fine. You're still active. Still sharp. Still moving through the rhythms of life. But remember this. High cholesterol doesn't wait for permission. It doesn't ask how old you feel. It acts quietly, and often without warning. And that's why awareness isn't just useful, it's life-saving. If any of these signs felt familiar, if you've brushed off the leg pain, dismissed the yellow patches, laughed off the memory lapses, ignored the chest heaviness, or watched a wound stubbornly stay open, don't wait. Talk to your doctor. Request a full lipid profile. Understand your LDL, HDL, and triglyceride levels. It's not just about numbers, it's about clarity. It's about seeing the full picture before it's too late to change it. And if your numbers are high, don't panic. Respond. Because cholesterol can be managed. With the right diet, regular activity, weight control, and if needed medication, you can bring the levels down. You can protect your heart. You can protect your brain. You can keep your body strong, your memories intact, your future bright. Too many people wish they had acted sooner. Too many families lose someone they thought was just fine. But you're watching this. You're learning. You're listening. And that means you still have time. Time to make a change. Time to help a loved one recognize the signs. Time to treat your health as the precious, priceless gift it truly is. Because life isn't measured by the number of years we live, but by how well we live them. How clearly we see the signals. How quickly we respond to them. So listen. To your body. To the small pains, the strange signs, the subtle shifts. Because sometimes, the quietest warnings are the most important. And today, you know what to look for. Stay informed. Stay proactive. And stay alive.